Well, this is our second week discussing vaccines and autism. So last week we laid out the arguments for the pro-vaccine versus the pro-choice camp. We discussed some historical perspective on vaccination and how vaccines works in terms of how the immune system responds to the vaccine and the different formulations of vaccines. We laid out the challenges of vaccinating children because of their incomplete and naive immune system. And today we're going to go over some of the points that we talked last week, and then we're going to look at detail on the three important stances that the anti-vaccine has been advocating. Now, this is I showed you last week, this is the recommended immunizations by the CDC for vaccinating children from birth to 6 years of age. And as you can see here, interesting, the mouse didn't show up on the screen. Okay, that's fine. If you look at the vaccination, the immunization here, you can see a few common themes, okay? You can see that you have a lot of different vaccines introduced to the kids at different stages here of their age, and they're meant to protect different things. This is hepatitis B, to prevent liver diseases. Rotavirus here, RV, it's to prevent diarrhea. You get DTaP for example, pertussis. This is for whooping cough. You have PCV for pneumococcal. This is if you want to prevent encephalitis. The other one is IPV, which is the polio vaccine, and this is meant to prevent polio or paralysis. Then you have the regular yearly influenza vaccine here. You have MMR for measles, mumps, and rubella. And so they meant different things to protect our children. Now, the thing that you also notice that the regimen are repetitive. Some of these are booster shots, and we discussed last week, they meant to educate the immune system to produce more potent human response, more potent antibodies so they can neutralize the virus quickly. And that's the purpose of the repeated immunization. Now, so those are important factors that we have to discuss why we vaccinate our kids. Now, in terms of the anti-vaccine group, what do they focus on? They focus on three important questions. Main point is that the work of Andrew Wakefield, this is when he suggests that the risks of the MMR vaccines and autism, okay? That we're gonna get into detail a little bit. Last week I talked about the Tamiris hypothesis. This is a mercury-containing preservative, and they also indicated or suggested that link to autism. Then we talked the association between the increased exposure to vaccines and autism in children. As I said earlier, the exposure and the repeated immunization are meant to enhance the antibody response. So I won't get into that so much, but we're going to focus on the two top topics there. Now, in the field of the anti-vaccine arena, Andrew Wakefield is the leader of that group. Now, who is he? He is a British former gastroenterologist. Now, he's former because he no longer licensed as a medical doctor. His license has been revoked. And he's a medical researcher. He was a senior lecturer and researcher at the Royal Free Hospital in London. This is one of the most prestigious hospitals in London. So before getting to autism research, he actually did a lot of good work on Crohn's disease. This is an inflammatory of the intestine. It can be extremely painful. In 1993, he published a paper titled Evidence of Persistent Measles Virus in Crohn's Disease. This is actually can show that there are measles virus in intestine biopsies of patients with Crohn's disease. Then in 1995, he published an interesting paper showing that measles vaccinations is a risk factor for inflammatory bowel disease. These two studies are very interesting, and it's quite groundbreaking back in the day. Okay, and they're very impressive. So people wanted to repeat his data. This is what science is about, right? You put in something interesting, and people want to repeat your work, and that's how you perpetuate the science. You advance it. Now the problem was, no one could reproduce his data. Unfortunately, no one could do it. They follow his same technique on looking at the RMA levels in the intestine. They couldn't find it. So because of that, in actually 1998, he was so admitted by a paper that measles RNA is not detected in inflammatory bowel disease. So his work in 1998 actually contradicted his previous work. Now, but the controversy doesn't end there. He decided to associate vaccination, inflammatory bowel disease to autism. And this is how he jumped to that next study. That in 1998, he published a paper that we talked about last week. The title is Ileolymphoid Nodular Hyperplasia, Non-Specific Colitis, and Pervasive Developmental Disorder in Children. And published in Lancet too, one of the prestigious journals in the UK, in the world actually. So in this study, he made a few conclusions. The study enrolled about 12 children. And next week, we will actually discussing very specifically how the children were recruited and where they come from. We'll get into that detail later. But this is some of the general observations from that paper. He found that the onset of behavioral symptoms was associated with measles, mumps, and rubella vaccination in 8 of the 12 children that he looked at. Okay? And then there's one child coming out with measles infection, another one coming out with otitis media, which is ear infection. The onset of behavioral symptoms are by the parents, so this is documented by the parents, not by professional. So remember that. He went on to conclude that behavioral disorders, including autism, disintegrative psychosis, and possible post-viral vaccinal encephalitis. So some of these behaviors are 9 of them, 9 out of 12 are autistic kids. So he concluded that we identify associated gastrointestinal disease and developmental regression in a group of previously normal children, which was generally associated with, in time, with possible environmental triggers. This is when trying to say that the environmental trigger here is the vaccination, okay? And it is associated with gastrointestinal disease, and that lead to developmental regression in a group of normal kids. So these are kids that now get vaccinated, have intestinal problem, now they get some sort of a neurological problem, okay? Now, he reasoned this, which is kind of interesting. So a lot of autistic kids, they tend to have intestinal problem. We don't know why, a lot of studies on that. But he reasoned that the actual MMR vaccine is injected, when injected into the arm, the measles vaccine migrates into the intestine, and then it causes infection, inflammation. That's why you see destruction of the intestine, because of the measles vaccine. Now, because of that, you ingest a lot of proteins in our body. And they, instead of, when they pass through the damaged intestine, they could not filter, for example. They get into the bloodstream, get into the brain barrier, and get into the brain. Now you have some sort of a brain inflammation. And that's somehow associated with neurological problem like autism. So that's his argument. Now, we can decide we want to buy that or not, but we'll get into that a little bit later. So he didn't have his solution is kind of interesting. Is that he said to alleviate this problem, you have to separate the MMR vaccine into 3 different vaccines. Whether it's one vaccine, which is the measles that caused this neurological problem, or 3 of them combined, it wouldn't matter, but that's his solution. Now, the problem with the solution is that the British drug company at that time, do not make MMR vaccines in 3 different separate vaccines, right? They all make it together. So for him to suggest that, either you don't vaccinate your kid, because there's no, or you don't use MMR at all. So that's the problem with what he suggested. So now, from 1968 to 1998, in terms of the vaccine uptake by the UK, the children in the UK were like from 60% up to 98%. Okay, but because of his suggestion, when they look at the kids that were immunized at that time, they see the significant drop in vaccine uptake, which coincided with the large measles vaccine outbreaks in England and Wales. So if you look at the chart here, right? If you look at the break line here, which is the vaccine uptake, and they at the 90-some percent that I mentioned earlier, from 95 to interest in 1998. So what happened in 1998? That's when this paper got published, and it popularized. So 1998 here, you can see significant drop in the number of children that got vaccinated. And this is the outbreak size that predicted because of the not vaccinated kids in 1988. You see all the line there. Here is the same observation here, is that from 95 to 98, you see the outbreak size to be much smaller compared to 99 to 2002. So because of his suggestion on the side effect of MMR vaccine, the consequence is that kids in the UK stopped getting vaccinated. Now, measles are a very widely spread, highly contagious infectious disease. And it can cause about 2.6 million deaths per year. This is prior to vaccination. In the UK, prior to vaccination, it caused about 100 deaths per year. So this is pretty significant, okay? So the disease, even now, is one of the leading causes of death among young children globally. The complications are blindness, encephalitis, severe diarrhea, dehydration, ear infections, and severe respiratory infections, such as pneumonia. So the consequences of measles are very deadly infection. So because of that, in 2006, a 13-year-old boy in England died from measles in more than a decade because of parents decided not to vaccinate their kid. Now, so in 1998, you got this big news come out that MMR vaccine caused autism, intestinal problem, create this public outcry, okay? Like I said, if it's true, we got to repeat the data, if that's correct. So there's a big effort from all over the world, Japan, Finland, Denmark, US, looking at huge number of populations. This is population to see if this is correct. Within that short span, 1998, 2005, there's 21 major studies. There's a lot of them, but I used about 21 of them. One of them here is from, this one is from the UK, okay? And they look at 498 cases of children with autism. And in there, there's 261 kids with core autism, 166 with atypical autism, and 71 kids with Asperger's syndrome. And they found that there's no temporal association between onset of autism between 1 and 2 years old after vaccinated with MMR. This is a huge study. This is major, using a large number of kids there. And then there's a follow-up study where they look at 305 children aged 12 and younger. They show no association between MMR vaccine and autism. Now, this is the most impressive study I look at. And this is actually in Finland. It's in Finland, where they look at 1.8 million individuals, from 1990, 80 something to 1996, I think. They look at 1.8 million kids with over 3 million doses of vaccine, MMR vaccine. And what did they find? They found that there is no adverse reaction established that connect MMR and autism. Now, so I guess this is Denmark, that's got to be Finland. Then in Denmark, they look at about 500,000 children, and they came with the same conclusion. There's no association. This study is in Japan. They look at a population of about 300,000 people, and they show no association. So there are ample scientific evidence that refuted Wakefield's claim. Now, he has other claims that actually still exist today, that people sort of refuted that. Again, we talk about that he first looked at measles actually persists in the intestines of kids, autistic kids. That's his conclusion. And there are a number of follow-up studies that there's no evidence of measles virus in the intestine. And they use the same technique that he used for his study. The data could not be reproduced. Now, the other claim he made is that MMR caused a leaky gut, and combination MMR vaccine caused intestinal disease. There are a few studies they show that, especially with the Stefano and Chan, they have 2 studies show that children given MMR were not more likely to develop bowel problem than children given the vaccine separately. The other thing that he advocated is harmful proteins should go back and forth. So you have protein again in the gut, get into bloodstream, get into the brain, right? So the idea is that proteins should go back and forth. From bloodstream, cancer go to gut, and if you look at the fecal matter, you can see those proteins. We cannot go one way, not the other way. Well, when you look at the fecal samples of those kids, they see nothing that suggests harmful proteins that come from the gut or the bloodstream. Now, this is also the arguments that he and other people are making, still making now, is a combination of MMR overwhelm a young child developing immune system. Like I said, when you look at neonates or children with their incomplete naive immune system, this can be true, that if you vaccinate them too much, they will have a very uncontrolled response, right? As immunologists, that can be true. Now, the only problem is that back in the 70s, when they used the smallpox virus, which it's a live attenuated virus for vaccination. And that virus is a pretty big virus, has about 200 proteins in it. Okay? Now the measles has 10 proteins, the mumps have 9 proteins, Rubella have 5 proteins, so total about 24, and they get 5, 6 of this, so a total about 153 total. Versus a smallpox, which about by itself 200 proteins. Okay? Now the incidence of autism back in the 70s is much lower than now. So if overwhelming the immune system is the culprit, then in the 70s or before that, you should have a lot more kids with autism. So this is not true. The reason why the proteins are important because your immune system responds to the virus by a way to respond to that protein. It's not the virus that responds to, it's actually the protein expressing the virus that the immune system responds to. So that's critical. Okay? So, and this is something that actually I'm struggle with is understanding, is there a coincidence of at that age versus vaccination and kids with autism? Is there a coincidence between MMR vaccine and autism? Okay? Now, if you look at this is by the Foundation Autism Speaks, and they have a huge network of people, of parents who have autistic kids. And when you look at this study here, and they recruited up to 5,000 cohorts. This is huge, more than that. Okay, and they look at they send out questions. They look at the question is they ask the parents at what age when they see skill loss by their children, and there are a few questions that they look at their speech, the language, mobility, social skill, daily living skills. And they're asking which of those, at what age where they start losing some of those skills, right? And then, and here's the graph they look at, is that, you know, if you look at the peak here, this is kids with autism here, the blue peak. And you see drastic increase from 7, 12, 13 to 18 months of age. Guess what happened at this age? This is when they get the first MMR shot. So, is it a coincidence? This is the age where you start to develop a lot of the, motor skill. You talk a lot of social skill. I have a kid. He's 6 months old, 7 months old now. You know, playing full, talking, blah blah blah. I have no idea what he says all that. But this is where they start to develop those normal speech, right? And also, this is when you get the first MMR shot. So, is there a coincidence? Now, so this is the first video that we're going to watch. We're going to look at, now we tend to diagnose autism about 1 year old up to 3 or 4 years old. But I want you to just look at some of the videos on some of the early signs of autism of kids, probably at one age, 1 year old or a bit older, but maybe before that parent did not see. And I want you to see this, because this is important in how we can associate autism with the vaccine.
We had therapists come in for Jack, and they looked at Riley and they expressed significant concern and said she's too good. And then I looked over and realized my daughter was just sitting there staring at a wall for hours and would just sit and hide behind the curtain for hours, and you feel like an idiot for not catching it, and then it hit me like a ton of bricks, and I knew, here we go again. And that was when we called our pediatrician, and we were already in this early intervention system, so we called up some people from the county so that we could have her evaluated right away.
Right.
So at about 7 months, they knew that she was significantly delayed.
So that's a testimony of a mom who did not recognize the early signs of her kid, of one of her kids that exhibited some symptoms of autism. Now, here is a next video, and she will also express the same observation that
I just had a gut feeling from, I'd say maybe 10 or 11 months, that there was something wrong. And I had spoken to my pediatrician about it. And of course, my pediatrician knew nothing about autism or how to diagnose it. So she told me that it was probably just a phase, that he would grow out of it. And I should have gone with my gut feeling, because I waited about another 5 months before I took him for a hearing test to rule out, being deaf or having a hearing problem. And then I had him evaluated. And that's when I first found out that he showed signs of autism.
So that's a mom, and she talked about at 8 to 12 months, she can start seeing some sign of autism in her kid. Now, if you go online and watch some of the YouTube video, you can actually see some of the kids develop these symptoms at 3 months. Now, I personally talked to a few parents who have autistic kids, and they actually told me that some of the symptoms they see now that they know their kid's autistic, they could see that at 3 or 4 months old. That they didn't pay attention to it. They thought this is all normal behavior. And as a not trained professional, you can see that. Now, the next video we're going to see, so I don't know whether they get the vaccines or not, but this is a mom talking about her twin son.
Push. Push.
So the first one is the, I guess you can tell.
Push. Uh-oh. Yeah, it fell off. That's right. Here it is. Uh-oh. Go. Push. Good boy. Ready, set, go. You can push. No, stay up here. Stay up here. Go. Stop. No. Nathan. Go. Look, here it is. Keep the train. Stay up here, please. Push. Good boy. Ready, set, push. Go. Push. You can push. Yeah, stay up here. Stay up here. Yeah, it fell.
So, this is the most interesting video I've ever seen. This is a twin. Now, whether they get vaccinated or not, it doesn't matter. One, you can see the first one is it's a normal child that interact with the parents. He shows signs of interaction. The second one is very distracted. If they were both vaccinated, they should have the same problem, right? If they didn't, then there's something else that caused them to have one of the child have a children to be autistic. So, to me, that's a very interesting contrast there. So, the conclusion that I had for that is there's really no connection between MR vaccine and autism. From what I've looked at some of the bigger studies, some of the associations that I could show you. Now, the next one is the preservative in the vaccine, the formulation in the vaccine. Okay, what's in the vaccine? And last week we discussed thimerosal, which is a ethyl mercury preserved in the vaccine. Now, the history of the ethyl mercury is that it's invented by Eli Lilly in 1928. It's a potent antimicrobial agent, and it's much more effective than phenol against Staphylococcus aureus. The other thing interesting is that animals like rabbits and rats can tolerate significant doses of ethyl mercury. Then in 1928, there's an outbreak of meningococcal meningitis in Indiana. So they decided to use ethyl mercury to treat patients who were infected. So they recruited 22 patients. It didn't help. They learned that it didn't have any therapeutic value. Couldn't help the patients at all. But one thing they learned that when they injected the patient 180 ml in 1% dosage, they used for 5 doses, patients were pretty normal. They can tolerate high doses of ethyl mercury. Okay? So because of that, they thought it would be a great preservative for vaccine, because in the early 20th century, you have a lot of contaminations in children immunization. An example was that in South Carolina, right, in 1916, you have a type of vaccine that contaminated, and it causes 68 severe reactions, 26 abscesses, and 4 deaths. And then the story in 1920 in Queensland, Australia, a pediatrician, George Thompson, he tried to vaccinate a lot of kids with diphtheria vaccine. And 12 out of 21 children were inoculated with contaminated vaccine. And they actually died from it. So there's a need to create an effective vaccine with effective preservative for antimicrobial function. Now, what people confuse about mercury is that there's ethyl mercury and there's methyl mercury. Okay, so they are different. It's like you're drinking ethanol, which is alcohol, versus methanol. One has extra methyl in it. One can kill you, the other one make you feel good. Occasionally, maybe. Depends. Today probably is. But Friday. So we have to learn the distinction of what the two are. Now, there are 2 important incidences involved in methyl mercury. This is the environmental mercury. This is mercury you found in the environment, in the water, in fish, right? This is not the synthetic ethyl mercury in preservative. So you can confuse them as one. They have different things. We're going to talk more. One is an incident in the 1950s in the fish community of Miyamata Bay, Japan. Now, the story is that there's a chemical company wanted to make a factory in the bay. What they do is they expel a lot of the waste from that place. And the residents of that community start seeing seagulls, falling off from the sky. They start seeing dead fish wash ashore. They start seeing cats dancing in circles and just die, right? And then the other thing is that then the doctors start to see a lot of people coming in with staggering gout. They couldn't walk properly. Numbness in their feet and hand. They start to see a lot of neurological problem with these people, right? Then they realized that they were, so they thought there must be some sort of viral encephalitis in the area, right, that infect all these people. But it's not true. So if you know about the Life magazine, would take enduring pictures of events in the world. And one of these is Eugene Smith. He's one of the most famous photographers that okay? And he took pictures of resins that came down with the mercury poisoning. And then he realized that the adults were normal, the mom were normal, but the child was severely affected by the mercury, okay? And some of the symptoms they have is that they they have seizures, they have spasm, they have deafness, a lot of mental retardation, okay? From that, they learned one thing is that this mercury affects the mom in utero. Okay, so it's had that effect. This is when the first time you realize that mercury has a very profound effect on fetus, not so much on the adult. Then another incident is that in Iraq in 1971, and again, this had to do with, I guess they stole a truck full of sea wheat, okay, and they sold it as food. And they were meant for seed germination. right? And they sold as food. So, and they couldn't read the bags with the label. The bag will label danger, poison, in English. Iraqi, that's the miscommunication. So a lot of them actually, about 500 of them actually died from eating the contaminated ethyl mercury wheat. So, I mean, this is an important story because it's two incidences where it changes how we think about mercury, but we have to know which one are we talking about. One is the methyl mercury, which is the environment, right? The other one is ethyl mercury, has an extra methyl group there. Methyl is a natural man-made. The one is essentially a man-made, and that's found in preservative of vaccine. The one thing that this is a study look at the breastfeeding mom, okay? Now, if you look at the breast milk of mom, it has about 272 microgram of methyl mercury versus a thimerosal-containing vaccine, TCV, is about 100 microgram of ethyl mercury. So even breast milk has a good amount of mercury in them. Then the other things I want to look at is actually, even though here they show the half-life in breast milk infants are unknown, turns out the half-life of methyl mercury is about 50 days, compared to ethyl mercury is about 7 days. So the properties are very different. And here's a picture of a mom taking care of her son in a bath, and it's taken by Eugene Smith. That I thought it's kind of enduring. So that's a little bit background. So by 1997, infants received 3 different vaccines that contain thimerosal. The DTaP, hepatitis B, and the Haemophilus influenza type B. The total is about 187 microgram by 6 months of age. Guess which one doesn't have thimerosal, MMR? So you can't make that connection. But it's actually a different kind of vaccines, the 3 here. A total 187 milligram. Now, this is the EPA, the FDA, and the ATSDR, which I don't know the acronym for that. But they look at, this is sort of like the exposure limits that are allowed by the different 3 government agencies. The EPA, 106 microgram, 319, 425 by the FDA. So at 186, that's a little bit higher than what's recommended by the FDA, the EPA. Okay? So because of that, there's a panic that we got to get rid of thimerosal. And it's driven by just sheer, not science per se, but just panic that you have the 3 vaccines have increased amount of thimerosal compared to what allowed by the EPA. And because of that, the American Academy of Pediatrics and the CDC released a statement saying that even though there's no evidence thimerosal in vaccine preservative that cause autism any harm at all, the groups agree that thimerosal-containing vaccine should be removed as soon as possible. And they actually admitted that there's no scientific evidence at all, but to calm the pupil, 1999, they took that step. Now, it's a simple step that they took, but it has some unintended consequences. The first one is the misinterpretation of the guideline. They didn't have a guideline on how physicians should do this. So one of the things that they said, hospital were advised to defer the birth dose of hepatitis B vaccine from 2 to 6 months in infants of hepatitis B seronegative mothers. Okay? Now, remember this is on, so they said, if you are infant of a seronegative hepatitis B mother, so you have no hepatitis, you can delay that vaccine from 2 to 6 months. Okay? Well, they didn't understand that. They said, we're just going to delay everything, whether the mom had hepatitis B or not. So that's one confusion. The second is that by the fact of removing thimerosal from the vaccines, okay, it causes the patients and the physicians to become suspectful of the dangerous effect of thimerosal, independent of the dose age of administration. Just the fact of removing it, people become suspectful of that. Now, removing thimerosal is meant to maintain a public trust in immunization. But now, because of not having a scientific backup, it's actually make the parents less confident in the professionals, even before the move of thimerosal. Oh, so it worked now. Okay. So if the assertion was correct, that thimerosal, which is a mercury derivative, can cause autism. But when the CDC and the AAP decided to stop every vaccine that contained thimerosal, you should see a drop in autism. That would be a common sense observation to this. Is that true? So this is a study out of California, state of California. And I can see that there's a gradual, it's actually pretty fast increase in incidence of autism from 1995 to 2013. And when we removed thimerosal in 1999 here, we did not see the drop in autistic instances. This is another study from Denmark. They're looking at huge amount of data. From 1970 to 2000. And Denmark somehow decided to remove thimerosal in 1992, much earlier than us. And you can see here the incidence of autistic children remained pretty high and actually increased. So, conclusion is that vaccines containing thimerosal have nothing, or at least extremely little, to do with autism. Okay, so for this lecture here, my conclusion is that there is no risk of MMR, vaccine autism. We have evidence that shows that vaccines containing thimerosal do not cause autism. So by next week, we will talk about that paper by Wakefield. We get into look at how he created those data, how he generated data, and how he interpreted the data. And then we're actually going to look at the consequence of that study. Thank you very much.